So our topic this evening is really, really relevant. And the reason I say this is because tongue diagnosis in Chinese medicine is a method of diagnosing disease and disease patterns. So visually you inspect, which is one of the four methods of diagnosis. Now, one of the major diagnosis methods, this started actually at the first century, AD. That's where the records, but I'm pretty sure without, it has been started before, only it wasn't recorded. So the tongue provides important clues reflecting the conditions of the internal organs. And it's kind of outer reflects the inner. So it reflects internal disharmony. So studies have shown, even in recent studies in 2023, that the tongue color, thickness, even has been relevant in COVID-19 progression. So according to Zhang, the standardization of tongue diagnosis can supply the general public and Oriental medical doctors with convenience. So what we're trying to do is actually inform the public as well. And in that way, they could take a look at their tongue, the same thing as diagnosing, brushing their teeth. Now, what in particular we're going to tackle today is sublingual veins. Sublingual veins are very, very important because in recent studies in 2023, and I will be sharing my sources, it provides essential information about our health. So in order to look at automate tongue diagnosis, we look at sublingual veins because this is where you can actually see some patterns of blood stasis or stagnation, especially in pathological, chronic, and severe illness. So sublingual veins, if you confirms what you can see at the surface of the tongue, and what more can this be delivered by our very own speaker, an authority in the field, Dr. Hector de la Cruz. So I will go ahead and announce him and proceed with our presentation of tongue diagnosis sublingual veins.
Thank you, Dr. Ryan. I would like to make a correction. I'm not an authority on the field.
Still.
So we're all studying. Okay, so I'm excited because I believe that this is a very good tool to actually monitor your patient's progress. So today, as usual, we're going to have the sublingual veins examination, a quick and comprehensive approach. Our objectives, of course, we shall discuss the clinical significance of looking at the sublingual veins and also discuss the preventative value of sublingual vein inspection and is this very relevant in Western medicine? In fact, the Western people, they have their own take for sublingual veins. The origin of the sublingual veins is at the ventral surface of the tongue. It joins posteriorly with the deep lingual vein to form the vena comitans of the hypoglossal nerve. There are two prominent veins, one on each side of the frenulum. When the tip of the tongue is rolled up to the palate, the two veins should be barely visible. Western medicine, they see distended sublingual veins as a sign of stasis in the venous return of blood, as it occurs, for example, in right heart insufficiency. Chinese medicine, similarly, often judges these veins as a sign of blood stasis in the upper burner. The intensity of color and degree of distension of sublingual veins in combination with other tongue signs will provide a picture of degree of blood stasis in the entire body. The severity of blood stasis is reflected in the intensity of color and the degree of swelling of the veins. So all we have to look for is the color, how dark is the color and how distended the veins are. Occasionally, these veins take on a thick, swollen appearance. If they are also dark blue in color, the blood stasis is severe, just like what you see on the picture. Sublingual veins should always form part of a routine examination of the tongue body. Under normal conditions, the two veins under the tongue are barely visible, and they have a faint, pale, very faint actually, because you can really see them clearly, pale red color. So when they become clearly visible, they are by definition pathological. So when you look at your tongues, on the undersurface of your tongue later, and I'm sure all of you would, make sure that you don't get to see a clear picture of your sublingual veins. If the veins are distended but they are not dark, the pattern is Qi deficiency. Whereas if they are too thin in relation to the sides of the tongue and the patient's body itself, it indicates yin deficiency. The most important sign with regard to sublingual veins is their purple color. If they are distended and dark purple, it indicates blood stasis in the upper burner, which includes the lungs or the heart, but it may also refer to the liver. Distended and dark sublingual veins are more common in the elderly, and they give an early indication of blood stasis before the rest of the tongue body becomes purple. So don't wait until your tongue turns purple, okay? Observation of the sublingual veins, therefore, has an important preventative value. Dark and dry sublingual veins indicate severe yin deficiency with empty heat. So let's take a look at this one. This is very common. When you see a tongue that has no coating, first you have to note the color of the tongue body. If the color of the tongue body is normal and there is no coating, that is yin deficiency. However, without coating, but the tongue body is red, that is yin deficiency with empty heat. Now, if you see a red tongue, you have to find out whether or not it has a coating. A red tongue with coating means there is full heat or excess heat. A red tongue body without coating means there is empty heat. Dark, swollen, wet veins indicate lung, spleen, and kidney deficiency with accumulation of fluids. Such observation is important also in P syndrome or the painful obstruction, chronic painful obstruction syndrome. If the sublingual veins are reddish and shiny, they indicate damp heat. Red for heat, shiny for damp. If yellowish, that's dampness. If white and slippery, then the etiology of your P syndrome could be cold dampness. And if the tongue is swollen as well, that is both dampness and blood stasis. So definitely, we should be concerned when we see a very swollen sublingual vein and a very dark color. So this is the picture of a tongue whose sublingual veins are slightly dark. Sublingual veins are dark and distended. As you can see, you could see some tortuosity there, no? Sublingual veins, very dark on the left side, okay? So you could see the veins there. Now, yellowish and shiny sublingual veins, so this is definitely damp heat. So you have to be very careful about the lighting. The best lighting would be natural light. Or you teach your patient how to take pictures of her tongue, particularly the sublingual veins. Very slight purple sublingual veins on the right side. Can you see the vein on the right side? Yes? Okay. And of course, this one is definitely very pathological, the two tongues. Now, let's take a look at some cases. We have here the tongue of a 38-year-old male complaining of epigastric fullness with sharp pains in the right hypochondrium. There is also fatigue, muscle pains, history of heroin and alcohol abuse, diagnosis as hepatitis C for 13 years. So as you can see, the sublingual veins, the tongue is red with slightly bluish sides, blue distended sublingual veins. So this is very, very liver blood stasis. Okay? And if you look at the coating, it is red, swollen, yellow, and greasy and dry. So that's definitely heat in the liver with long-standing retention of damp heat in the liver and gallbladder. Another example, we have a 31-year-old female. Complaint is painful menstruation associated with night sweats. So I think you're all very familiar with night sweats, insomnia, depressive moods, and fear. History of long-standing emotional problems and extreme mental demands at work. Western diagnosis is cervical cancer. So if you're going to look at the sublingual veins, they don't actually look very intimidating. But again, this patient was diagnosed to have cervical cancer. Okay, so if you take a closer look, okay, let me show you what I'm talking about. So you will have the veins are blue, very obvious. They're thick, tortuous veins, no sublingual veins. So what does this mean? Because the complaint is painful menstruation, so we would say that there is blood stasis in the uterus or blood stasis in the womb. And the tongue is reddish and slightly narrow. Okay, how many can identify with this kind of tongue? So that's definitely the onset of kidney yin deficiency. As you can see, you can't see any coating at all. And then the red tip will speak a lot about heat in the heart. Okay? Next, we have the tongue of a 42-year-old female with severe hair loss, fatigue, and sense of fullness in the right hypochondrium. History, use of contraceptive pills for 8 years. She was diagnosed to have malignant hepatoma. So as you can see, the tongue is, the sublingual veins are dark blue and distended. So what does this tell us? There is liver blood stasis. Of course, you already know the diagnosis, so you would immediately look at that. So if I were you, you should look for patients who have who have cancer. Look at their sublingual veins. Okay. The tongue body is reddish, slightly contracted. So that is kidney yin deficiency. And as you can note further, the anterior third is red with red points. So this is heat in the heart. And there is coating without root or no coating, stomach and kidney yin deficiency. Okay. Next, we have an 83-year-old male complaining of dry cough with night sweats, low-grade fever, intense feeling of heat in the body. He also has labored breathing and shortness of breath and exhaustion. Western diagnosis, chronic bronchitis and emphysema. Background to disease, heavy smoking for 60 years. And as you can see here, the sublingual veins are dark purple with dark spots. So this is definitely severe blood stasis in the upper burner. The tongue is dark red, small, and shiny. By the way, do not be happy if your tongue is so shiny. So that's lung, stomach, and kidney yin deficiency. Next, we have a 66-year-old male complaining of long-standing constipation, heartburn, stomach pain, extreme physical weakness, sweats, and pain in the bones. History of overwork, emotional problems. He was diagnosed to have prostate cancer with metastasis to the bones. So take a look at the sublingual veins. They are thick, dark blue, distended with dark spots. So that's definitely severe blood stasis. Okay? Red, firm tongue body, kidney yin deficiency. Coating is rootless, especially at the center, if you notice, and root of the tongue. So this is definitely stomach and kidney yin deficiency. And there is a slightly yellow old coating, which indicates retention of damp heat in the large intestine. Next, we have a 33-year-old male complaining of cough with blood-tinged sputum, pain in the chest, night sweats, constant low-grade fever, thirst, nausea. History of smoking 40 cigarettes daily for 15 years. So the diagnosis was inoperable bronchial cancer. Okay? So the veins obviously are very blue, very distended with branching, bright red capillaries. Can you see that? Oh, okay. Pale red, swollen in the anterior third and center of the tongue. So this is spleen deficiency with retention of phlegm. Red points in the anterior third, heat in the lungs. Yellow greasy coating at the root of the tongue. There is retention of damp heat in the lower burner. Okay? Now, according to Machocha, he would view the, sublingual veins that appear in combination with the normal tongue body color as an early indication of qi and blood disorders. Okay? But don't panic. As long as the color of your tongue is not purple, if you take a look at the sublingual veins and they are dilated, that means you still have qi and blood issues. Okay? This can be further expanded upon. Many women with uterine fibroids or positive pap smears, they often have tongues with normal body color and shape, but they have severely distended sublingual veins. Okay? So remember, you're not supposed to be able to see your sublingual veins very clearly. The veins are also visible when the penetrating vessel is afflicted with long-standing blood stasis, resulting, for example, from sexual abuse or multiple abortions. However, if the sublingual veins are thin and light in color, take note, thin, payat, no? Light in color, the blood stasis is not very serious. This diagnostic evidence should be taken into account when examining patients who suffer from menstrual problems, habitual miscarriages, or infertility. Now, let's go to injuries. Injuries such as bone fractures or torsion to the sinews, tendons, or muscles will interrupt, of course, your blood circulation. So what happens? You will have localized stagnation of blood in the channels, muscles, and joints. Now, this type of blood stasis is superficial and is usually found unilaterally, one side. Okay? So if you see a patient whose sublingual veins are distended on one side, then you may probably want to ask them history of injury or accidents. No, it may present on the tongue as a unilateral distended sublingual vein. Again, the sidedness of the injury and the distended sublingual vein may not coincide. Meaning to say, if you see it on the left side, it doesn't mean it's the left side of the body that is affected, not all the time. Accumulation of phlegm or dampit in the body can also be observed in the sublingual veins. In this case, they are reddish blue and they have a sheen, kumikinang. Other signs include blue, black, or dark spots. Okay? These signs are an indication of heart blood stasis that manifests as coronary heart disease or illnesses of the liver, such as chronic hepatitis, pili ka lang, cirrhosis of the liver, or liver cancer. Okay. In many cases, distended sublingual veins are indicative of an ongoing process of blood stasis in the body. Although some research suggests that the appearance of these veins is a sure sign of disease affecting the heart, lungs, and liver, a diagnosis using the sublingual veins does not always allow one to determine the exact location of the blood stasis in the body. This must be determined with the help of the other presenting symptoms. That's why it is very important that you should get a very complete history. Assessment is very, very important. In general, a valid interpretation of the severity of the blood stasis is reflected in the intensity of the color and the degree of distension and swelling of the veins. As one would expect, thin, bluish, distended sublingual veins would indicate that the blood stasis is mild. Okay? Now, let's have some practice. Who would like to volunteer? Ma'am SP? What should be the color of the veins? The veins, okay, we're talking about the sublingual veins. The vein should be, okay, dapat pale red color siya, pink, no? Pale red color, yeah, maputla, pale red color, and it should be barely visible. Okay, clearly visible veins, ano po sagot? Normal or pathological? Pathological, may problema na. Okay, so you have to continue treating the patient until you will see an improvement. What do sublingual veins signify? So if you have a patient who will ask you, why are you looking at my sublingual veins? Or why should I be very conscious about my sublingual veins? Anyone? Ma'am SP, go. Sa Tagalog,
Sublingual.
bakit kailangan nating tingnan yung ating sublingual veins? I mentioned that sa first part. Because it is an early indicator of blood stasis before the rest of the tongue becomes purple. Okay? So I'm sure all of you will be looking at your sublingual veins after the lecture. Okay, if the veins are distended but not dark, what does it mean? Ano po yung pattern?
So, sorry to, hindi ko alam prendo.
Okay. Who would like to try? Ma'am Annalyn, would you like to try? If you see a vein, sublingual vein is distended but it's not dark, what is the pattern?
At di pa man po nagsisimula yung blood stasis.
Okay.
Opo.
So, pag hindi pa nagsimula, it's only the chi that is involved, di ba?
Yes po. May chi deficiency.
Yeah, chi
Tapos
deficiency
titingnan na lang kung ano yung covering.
ang
Covering
galing.
nung ano, ng
O,
vein.
di ba? Maraming
Kung may
salamat. Ang
dampness.
galing
Opo.
talaga.
Thank
Huwag ka na
you.
tumigil. Chi deficiency and stagnation. Pwede rin chi deficiency or chi stagnation. Di ba? Pag may chi deficiency, may most likely may chi stagnation ka din. Next. Now, what if the color of the sublingual vein is dark?
Yan, start na po yan. May blood stasis na.
May blood stasis. The darker the vein, the worse.
Mas malala, yes.
Okay, yon. I'm sure. Don't worry, we will end soon. You will look at your tongue now. Okay, if the veins are dark, pero hindi purple ang tongue, what does it mean?
Hindi pa siya malala. Hindi pa
Okay.
talaga yung matagalan. Hindi
Okay,
pa matagal
yes.
yung blood stasis niya.
Yung blood stasis niya, short duration pa lang. Wow,
Yes.
galing talaga. Okay, now, kung ang veins are too thin pero kitang-kita, what does it mean? Anong pattern? Payat yung vein niya.
May blood chi deficiency.
Yin deficiency.
Yin,
Or blood
apa.
deficiency. Okay.
Opo.
Okay, dark ang vein tapos dry. O yan, magandang clue na yung dry yan. In-explain ko yung kanina when you look at the coating.
Opo.
Dark veins
So,
tapos
siya? May blood stasis.
Wala
Pero,
pa.
Wala pa.
Wala pa.
Opo.
Ano pa siya? Severe yin deficiency with empty heat.
Magiging
Remember?
empty heat pag red na yung tongue. Pero may may deficiency
Mag-uumpisa
na.
Opo.
Opo.
Okay, what if the tongue is dark, swollen, and wet?
Malala na siya.
Hindi pa naman.
Ah,
Swollen pa and wet ang veins, dark, swollen, and wet. Swollen and wet siya, ha? Lung, spleen,
Opo.
kidney deficiency,
deficiency.
elimination
Opo.
of fluids. Okay? So
Ayun.
lung, spleen,
Opo.
kidney. Ako kasi I always make sure that maganda yung lung, spleen, and kidney ng pasyente. Number 10, distended veins, the dark purple.
Ayan yung malala. Yan na yung malala po.
Sa Chinese
Matagal
medicine, ang tawag doon upper burner blood stasis or tinatawag na lung, heart, or liver
Opo.
blood stasis. So,
Blood stasis.
pili ka lang, lungs, liver, lung, heart, or liver.
Liver.
So, depende po sa symptoms. No? Number 11, in B syndrome, yung tongue niya reddish and shiny. Anong pattern po ito?
Siya? Fluid na, ang tawag dyan?
Okay, remember,
Meron siyang-
red siya ha, red
Opo.
siya. So may heat.
Opo.
Shiny,
May heat.
ano ba yung sinabi ko?
Injured
shiny?
body fluid.
Damp heat. Yeah, damp heat.
Damp heat. Opo.
Okay, B syndrome tapos, syempre pag B syndrome may painful obstruction syndrome yan no? Nakita mo, yung sublingual veins niya yellowish.
Opo, so
Dampness.
severe heat. Opo, may dampness. Damp heat.
Mabigat yung pakiramdam. 'Di ba? Pag gumigising siya,
Yes.
masakit yung katawan. Okay, pag B syndrome, and then yung kulay white and slippery. That's cold damp.
Opo.
Cold damp. Okay, lumalala yung kanyang pain pag malamig and nakatira siya o baka nasa semento siya nakahiga. Yan. In modern Chinese medicine, what does dark purple mean?
Blood stasis, blood
Okay.
stagnation.
Okay, sa modern medicine, ang ibig sabihin niyan hardening of the brain arteries. So kailangan magpakita at magpatingin na tayo ng neurologist. Okay? Pag dark purple, wag nating isawalang bahala lang. Okay? In modern Chinese medicine, distended, dark, and crooked, ang ibig sabihin nito, hardening of the arteries or atherosclerosis and
Atherosclerosis.
Yes. And also hypertension. So yung mga may hypertension dyan, you might want to take a look at your sublingual vein. Okay, what if you see small nodules, katulad ng parang rice or wheat grain? There is also atherosclerosis and heart disease. Okay?
Opo.
Okay, review. Pag distended yung veins, not dark. Qi deficiency.
Qi deficiency.
Pag thin, yung sublingual vein.
Qi deficiency ba din?
Hindi. Payat siya.
Payat.
Payat din
Blood
yung
deficiency?
yin deficiency.
Yin
Okay.
deficiency po. Opo. Yin deficiency.
Distended siya and dark
Blood stasis.
in the upper burner. So ano yung
Upper.
pipilian,
Opo. Sa heart.
pagpipilian natin? Heart, lungs,
Sa
or
heart, lungs,
liver.
and liver.
Oo. So kailangan bibigyan mo na ng food intake, o ano ba yung food supplement mo dyan, and then
Opo.
monitor yung gano'n. Okay, severe. What about dark and dry? Dark siya tapos tuyo. Okay, ito na yung tinatawag natin may empty heat, no? Severe yin deficiency with empty heat.
Opo.
Next, dark, swollen, and wet. Lung, spleen, kidney. Remember,
Lungs,
pag dark,
opo.
swollen,
Lungs,
and wet.
spleen.
Lung, spleen, kidney with accumulation of fluids. Pag reddish and shiny, ano ibig sabihin nito?
May heat na po.
Damp heat.
Damp heat.
Shiny damp, yung reddish heat. Pag yellowish,
Damp heat.
dampness. Pag white and slippery, cold dampness.
Cold nap. Opo. Cold dampness.
Swollen, white, and sticky, dampness, and blood stasis.
Opo.
Okay, pag distended, nag-uumpisa na ang blood stasis.
Blood
Right?
stasis.
Distended pero light colored. Hindi siya dark. What does it mean? Is it mild or is it severe?
Mild po.
Okay, mild or less severe. Distended and dark color.
Severe.
Yeah,
Severe.
severe. No severe stagnation of blood. Distended lang siya sa one side. Anong ibig sabihin
May
nito?
traumatic
Trauma.
experience.
Very good.
Opo.
Stagnation of the corresponding side as in injury to trauma
Yes.
or surgery or nagpa-opera siya, syempre, di ba? Yun.
Opo.
And then if the vein is covered by white membrane, ano ibig sabihin?
Dampness.
Yes. Or phlegm. Phlegm stays
Opo.
phlegm. So let us summarize. Maraming salamat po, Ma'am Annalyn. Thank you so much.
Thank you.
Are you excited?
Opo, nag-aaral.
Okay.
Sige. Na-screenshot ko na lahat. Sana aralin na naman. Sige po. Thank you.
So this is the summary of what we have taken up today. If the sublingual veins are distended, not dark, that is Qi deficiency. If the sublingual veins are thin, it indicates Yin deficiency. The veins are distended and dark, there is blood stasis in the upper burner. Pipili lang po kayo, lungs ba or heart or liver. If the sublingual veins are dark and dry, there is severe yin deficiency with empty heat. Dark, swollen, and wet, lung, spleen, kidney deficiency with accumulation of fluids. Reddish and shiny, that's damp heat. Yellowish, that's dampness. White and slippery, cold dampness. Swollen, white, sticky, dampness, and blood stasis. In Western medicine, if you see a dark if the color is dark purple, there is already hardening of brain arteries. Okay, so we endeavor to help the patient here. Take note, dark purple, there is already hardening of brain arteries. You may still be asymptomatic, pero nag-uumpisa na po yan. So, you should already do something. You attend the face-to-face lectures sometime in April on scalp acupuncture. Are you all attending? Thank you, Ma'am Letty Aboy, the Queen of Paay. Invite mo na sila. Oh, yung mga dark purple yung dila. Ay, yung ilalim pala ng dila. Sorry, sublingual veins. Okay, don't panic. There is still chance. Don't wait until hindi ka na makagalaw. So, I'm sure gusto niyo nang matapos yung lecture because magtitinginan na kayo sa inyong mga dila sa ilalim. Attend po kayo, Ma'am Letty. Can you please announce? Oh, yung hindi daw mag-a-attend, magkaka-stroke. Okay, go. Ma'am Letty. Ay, nakamute po kayo.
Pwede mag-share screen?
Okay, sige, wait. Sige po. Grabe.
Excited.
Excited. Okay, wait lang. Okay,
Madami
tapusin ko
sila
muna
eh.
to lahat. Ito na yung last slide eh. Wait lang.
Ay, sige
Tapusin ko
po.
muna to para
Tapusin niyo
medyo
po muna.
mas ano. Okay, pag tinignan nyo, dark purple. By the way, sa scalp acupuncture po, you don't need to have any background on TCM because this is very Western. And ang maganda dito, you might want to, what's this? To connect with neurologists. In fact, when I was in Paay, I met one neurologist there. He was so interested because he has heard a lot about scalp acupuncture. And mind you, there are actually 10 types of scalp acupuncture. And Paay, with the kindness of our very good doctors, Dr. Gavino, si Dr. Webb, and also Dr.
Panotes.
Panotes. Yeah, Panotes. Okay. Another is, okay, pag nakita nyo yung dila, yung veins nyo are distended, dark, tapos tiku-tiku pa, crooked, no? Hardening of arteries and hypertension. So if the veins protrude a lot and they look like earthworms, the disease is severe. And also, pag meron kang nakitang small nodules na parang rice or wheat grains, you have hardening of arteries and heart disease. Thank you very much for your attention. I will now give the floor to the Queen of Philippine Academy of Acupuncture, Inc. We'll invite all of you. Everyone is free to come to attend. Just coordinate with Ma'am Leticia Aboy na hindi na yata natutulog.
Ay, bawal yun, Doc.
We're done.
I-share screen ko lang po.
Okay po, no problem.
Thank you po.
Sure.
Yun po. Opo. Open to all daw po. And then, it's a face-to-face lecture dito po sa PTAC, ground floor. 20 attendees po yung expected to come on April 15 pa naman po, April 15 and 22 kay Dr. Webster Lim. It's 2 days, and April 29, Dr. Olympia Panotes, May 6, Dr. Romeo Gabino, and May 13, practicum po. So, we will give everyone the chance na makatusok po with the supervision of your teachers po. And then, actually, mauuna po yung Qigong
Okay.
para
Muna rin.
anticipation. Opo, anticipation para hindi sumakit po yung ulo nyo. So, bago sumakit ang ulo nyo, mag-Qigong po muna kayo. Sandali lang po.
Okay, for Qigong naman, face-to-face din yun. We have a celebrity doctor. I don't know if you've heard about him. I'm sure some of you did. Okay, so yun. So we're very excited because madami daw talaga interested. Yan,
Ayan
Qigong.
po. Qigong. Face-to-face lecture sa East Avenue po tayo, 7th floor. 8:30 a.m. pero kung malilate po kayo, okay pa rin yung 9 a.m. And yun po, it's a whole day class. So marami pong ma-share sa inyo si Dr. Randy Delios. That's all po. Thank you po.
Okay. And also, pwede pa kayong humabol on Monday. Webinar naman din po ito.
Ay,
Dementia, no, ni Dr. Webb Lim. Please come. We're open po tayo sa non-members. Di ba? Okay. So we started last Monday. Kahit
Yes po.
Monday, ito po, forgetting the problem with Eastern and Western solutions. You can still make habol.
Okay.
Ang ano po nito, ang Zoom link is sa PAI po. So you have to make
Opo.
friends with Ma'am Leticia Aboy. And this
Opo.
is
If you, opo.
yes.
Opo. Sige, Doc.
Kasi
Kahit po.
tayo, hindi na tayo bumabata. And of course,
Opo.
meron pa tayong inaalaga ang mga seniors or baka tayo senior na rin soon. Hindi ko naman kayo pinapakonsensya.
Yung sa akin lang, if you want na ma-anticipate, na makalimutan yung ituturo sa, ano po, sa scalp acupuncture, might as well attend the
Yes.
dementia.
Actually, all of our topics are interrelated, no? Kung tuloy-tuloy yan.
Yes po.
If you don't want to grow
Oh.
old having dementia, no? And we all know that Alzheimer's is the most common cause. Yon. Thank you
Sa
very
dami
much
ng
po,
inaaral.
Dr.
Thank
Q.
you po.
Unfortunately, yung ating Qigong and the scalp, hindi po siya webinar kasi daw, siyempre naman, no, magtutusok ba tayo na, mas maganda talaga yung
Opo.
practical, di ba? But
Opo.
anyway,
Yun po. Thank you po.
do you have other announcements? Okay, we encourage all of you to be part of our PAI para naman i-promote na natin, no? Yung mga hindi na active sa PAI, you might want to renew your membership. And of course, Dr. Ryan, we welcome you. Ito po si Dr. Ryan, siguro mga 2 linggo lang na natuto na ng acupuncture. So, nakakatakot kaya kailangan marunong ka talaga. Ang dami niyang tanong. Andiyan kapag magbibigay ka ng kailangan i-cite mo talaga saan mo kinuha yung info. Kaya ayoko ibigay dahil chine-check niya kung binudol ko siya. Okay? That's Dr.
Bagay
Ryan.
po siya. Opo. Bagay po siya
Welcome
kasama
mo
ni
siya sa
Dr.
PAI.
Opo. Hi, Dr. Ryan.
Sabihin mo
Bagay po siyang
kay Ma'am
kausapin ni
Rochi
Dr.
Kagara. Oo, Ma'am Rochi is in di ba? In Dumaguete. Oo.
Apo.
Okay.
Siya kasi yung in charge sa membership. So, yun. And I've known
Thank you po, Doc.
Dr. Ryan as a person with a very big heart. And pwede natin siya gamitin, Ma'am Letty.
Ano po? Thank you,
Okay.
Dr. Ryan.
Thank
You're
you.
welcome
Thank you.
po.
So do you have anything to add? I'm done now with the presentation. I hope everybody had absorbed everything. Or you can just watch the video again, no?
Wala
Yeah.
naman pong there's no question po sa sa what do you call it, sa
Yeah.
chat box.
Oo.
And then I also posted sa chat box yung references just in case they needed further reading. Ano lang, may mga short links, so the what do you call this, most of the references are free.
Yes. And also sa ating research, I don't know if I'm allowed to say it, napaka-importante po ng role ni Dr. Ryan. Actually, I find the research boring. But anyway, just yung mga numbers. Ay naku, naalala ko tuloy. Thank you po, Ma'am Janine. See you later for the assessment. Okay, what else? Okay, we're done. We'd like to invite you again next Saturday. Wala po tayong, meron tayo pa, hindi pa Holy Week next week. Our topic is prostate problems. Okay?
Wow.
Yes. So please invite everyone. Ayun.
Wow. Thank you, Doc,
Thank you very
for
much.
your
Thank you, Ma'am Leticia, for
Oh,
really
for
attending.
offering free services. Opo.
Yeah.
Kakaiba po kayo talaga.
Very
Very generous. Thank you po.
Hindi, mas generous siyang isa dyan, no? Namimigay pa ng pagkain yan.
Sana umabot sa Manila.
Kaya
Sa
imitayin
Quezon
mo
City.
siya. Okay. Ano na
Dr.
naman
Ryan, huwag ka mawawala sa convention po.
Sa
October
October,
20,
po yun, no?
Oo.
Opo, October 26 po pala. Everyone is invited po. October 26, last Saturday of
Yeah.
October po. Sa
Sige.
Great Eastern Hotel. Great Eastern
Nagkakataon dahil
Hotel.
nagsisale yung Cebu Pacific.
Ay, o nga pala,
Opo.
i-remind mo ako. Sige na, go.
Yeah, I'll remind you.
Ano ba, piso na
Opo.
lang?
Opo, mag-book na po kayo para ano.
You
Para
remind me
masaya.
later. Oo, oo.
Opo.
Okay,
Thank you po.
thank you po, Ma'am Letty. Okay, yung iba
Thank you din po.
dyan, para medyo mas makabuluhan yung ating practice, please be part of PAAY. No? We're also part of
Wow,
PAAY.
pwede lang.
Oo, ito po yung talagang talagang lifeblood ng PAAY. Mukhang nangayayat na yata sa So, ano naman kayo, mag-attend po kayo.
Enjoy.
So, we hope
Opo,
to
enjoy,
see you
enjoy lang.
all. So, please make friends with Leticia Abuy on
Opo.
the chat. Yeah.
Opo.
Sa
No
FB.
need for pattern weaving, di ba, Doc? Yung scalp.
Ayan, no need. Kasi ang scalp, microacupuncture yan eh. With microacupuncture, you don't need any principle, any basics. That's not TCM. Pero,
Galing nga.
yeah. Pero sa tingin ko kasi, no, this will actually introduce people to acupuncture.
Yeah.
So, nag-evolve na po talaga. It's more neurology. So,
Mm-mm.
okay, attend na kayo para hindi kayo magka-dementia. Okay?
Opo.
Or stroke. Maraming salamat po. We're done. Dr. Ryan, have something more to add?
Wala lang po. I just want to thank everybody for attending, and I know we are brought here for a reason. In that way, we could also help others and also enrich our knowledge that we can be of assistance to others as well. So thank you for attending, and hopefully everybody has a good weekend ahead of them.
Yeah. Thank you very much. Good.
Opo. If there, benefit din po nila sa sarili po nila, yung
Yes
mga
po.
tinuturo po. Okay.
Yes po.
Thank you po.
Pag-screenshot mo na, Ma'am Letty, yung mga nag-attend para pilitin mo na silang mag-member sa PAAY. Okay. It's always good to be part of a prestigious organization. Hello,
Opo.
Ma'am Wilma.
Ayoko po mamilit ha, hindi po totoo yun. Pero ang number ko po, 0927-267-6227.
Ano yan, Gcash? Ano, joke?
Gcash, pwede din Gcash pag malayo po kayo.
Okay. So, yun po. We hope to see you again next Saturday. Wala tayo sa Holy Week, of course. So, prostate problem.
Prostate problems.
Thank you so
Pwede po
much.
mag-group picture? Mag-group
sige.
picture?
Yeah,
Ano
sige.
mag-group picture? Ikaw na mag-group picture. Sige,
Opo,
group
opo.
picture tayo.
Can
Smile
everyone
po
turn on
kayo.
their cameras? Po,
Remembrance
pwede?
po yan.
Smile.
Opo. Smile, labas po kayo ha. Next po, meron pa ba? Ay, isa lang.
Isa lang.
20
Pakunti lang
participants. 1,
tayo.
2, 3, 4. 2, 4, 5. Isa lang po.
Okay, very
20.
good. So thank you so much, everyone.
Sige.
Thank you for your
Ingat po
time.
kayo.
See you
Thank you
again.
po.
Ay, Ma'am Marsha from Melbourne. It's always good to see you. Of course, everyone there. Maraming salamat po. Have a great weekend.
Thank you so much. Much
Thank
appreciated.
you. Enjoy.
Enjoy po.
See you soon. Bye-bye.
Opo.